Give you our Friday 2:30 update on the impact of the COVID-19 epidemic in Mobile County. First, we'll start with those worldwide numbers that are still just staggering to think about. More than 32 million cases of COVID-19 disease around the globe, with over 984,000 deaths. So I'm afraid we'll probably the next 7 to 10 days see that reach 1 million deaths. In the U.S., nearly 7 million cases of COVID-19 disease, with over 200,000 deaths right now. It's a little bit over 203,000. And again, India and Brazil are second and third in the number of cases and deaths reported worldwide, with the U.S. still being in the number one spot. In Alabama today, the dashboard updated this morning and was displaying 150,658 cases with 2,491 deaths. Before we get to the Mobile County numbers, I will note, if you visit the ADPH COVID data dashboard frequently, you notice today a rather lengthy disclaimer about some changes that are coming up, some labs that were processed that sort of artificially inflated the number of probable COVID cases that were added to the dashboard. I believe there were laboratories in 2 counties in Alabama that they processed a backlog of laboratory results. It didn't affect Mobile much, but in those 2 counties, there was a rather large increase in the number of probable COVID cases reported. They're also commenting on advances in science and testing science around the SARS-CoV-2, the virus that causes COVID-19, and that, as more and more healthcare providers begin using these rapid tests or antigen tests, there may be some slight adjustments or maybe some slight estimate of the number of cases. If lots of people are using tests but not reporting to us, that we may see some adjustments. But we try to keep that dashboard as accurate as we can by including test results from any facilities that are reporting both positive and negative results, either PCR molecular test or the diagnostic antigen tests. So just want to let you know about that. Let's see, again, that is a rather lengthy sort of disclaimer, so take a read on that. If you have any questions about it, send them to us by Facebook Live, and we will try to discuss those on Monday. So in Mobile County today, the report that is published by SSI Group, our reporting partner, our data analytics partner, we're reporting 13,358 cases of COVID-19. 52 were added yesterday. So this week, we have seen on Monday, it started with 59, 72, 48, 41, then 52. So we think the increase earlier this week was due to power outages and people not able to communicate electronically. The laboratories and maybe some labs not open during the aftermath of Hurricane Sally. So it looks like we have begun to level back off a little bit. So that's good to see. We have 294 that have died with COVID. That's an increase of 1 since yesterday. We've had just a few additional deaths reported to us this week. The cumulative number of people hospitalized with COVID-19 stands at 1,977. That's an increase of 12 over yesterday. And if we look at the number that are currently hospitalized with a COVID-19 positive, it stands at 64. So that was an increase of 2 from yesterday. So the average number of people hospitalized on a daily basis in our area, our Mobile County hospitals, has been in the mid to high 60s for now about 7 to 10 days. So that's really good news. So when we talk about, the fact that our case count has gone down, our hospitalizations have gone down, our deaths are trending down, our percent positive is trending down. I think statewide it's under 8% now. So all of these things going in the down direction are what gives us confidence saying that the burden of COVID disease in the community has been on the decline since the issuance of the mandatory mask order last month. If there were couple of indicators going down and one going up, then we might not believe, we might have reason to doubt that some of our trend data is not accurate. But we feel like, even though we know that there is an underestimation of the true number of cases out there, we still are thankful and comfortable saying that the number of transmission has been going down. Now, having said that, CDC published a report earlier this week on the changing age distribution of COVID cases nationwide, and commenting that the 18 to 22 age group, or that 20 to 29 age group had a 20% increase in the number of cases over May, June, July, and August. So it's that 20 to 29, that young age group, that's really driving community transmission. And, we have said all along that that's probably okay for them because they are likely to be asymptomatic or have very mild illness. But what CDC has noticed is that trend of 20 to 29-year-olds getting COVID is followed 7 to 8 days by people over 65 getting COVID. And so whether you realize it or not, CDC thinks that age group, those younger age groups, and we've been talking about this for some time, that is the age group that's driving community transmission, and it is impacting the burden of disease on older populations. So please, if you are in those younger age groups, and up to 40% of you may be asymptomatic. So if you're out, please wear your face covering so we can protect those most vulnerable populations in Mobile County. So on Friday, we usually report on the number of complaints. We've had just a handful of complaints this past week on complaints about restaurants or other permanent establishments who aren't following the Safer at Home order, and we are getting very few reports out in the community about businesses and other things that are not compliant. So thank you for the work that the employers are doing, that businesses are doing, that restaurants are doing to try to make sure that Safer at Home and order is followed and that the mask mandate is followed. All right, just a couple of questions or comments from, well, none from the media today, so that's great. One person has been questioning us about how can we say the trends are going down. Again, as an epidemiologist, when I see 3 or 4 or 5 indicators going in the same direction, then I believe that to be true. Let's see, here's someone questioning about singing in choir. There's a church who seems to have been bringing some people in. They're welcoming guests, which is great. We love welcoming church congregations, but they are trying to recruit more singers and continue having the choir, and at least one person maybe in the congregation or maybe related to someone in the choir had a concern about that and asked me to comment on it. So I just want to remind you about a report that was published last May that we talked about in great detail then. And basically the report said that choirs, church choirs in particular, are a high risk for COVID transmission. So in a report published by the Centers for Disease Control, it said after a choir practice with one symptomatic person, 87% of the group developed COVID-19 symptoms. And there were about 50 to 60 people in this choir. So it's really quite a stark reminder that anything you do to sort of raise your voice, it causes you to more forcibly expel respiratory droplets. I mean, sometimes even when I'm just trying to sort of, use my voice on Facebook Live, I'm expelling more respiratory droplets than I would if I was just talking in my normal voice at home. If you are shouting, as in during protests, you're expelling more respiratory droplets. If you are singing, like in a band or in a choir, then you are expelling more respiratory droplets and they are likely to go farther. If you are exercising and breathing heavily, then you have more and respiratory droplets that may go beyond just the several feet that usually will cause them just to come out and drop. So choir practice, singing in a choir, is a very high risk activity. And I really don't recommend it if you're trying to think about doing it with a mask. Probably not worthwhile, because it's still going to sneak out around your mask or your face covering. And a face shield really would have very little protection either, because those droplets can escape under. And in a choir, usually it's tiered, so you may have droplets coming over your head from someone who's behind you. So I really discourage the traditional practice of choirs practicing and singing. All right, let me see if that is all I had to say today about COVID. We have a couple of other comments to make, some non-COVID information to share. So from Amanda Arnold, our Women, Infants, and Children's program, she says that due to continued concerns for the health and safety of our WIC participants and staff, the Alabama WIC program will continue to follow COVID-19 waiver guidance by providing remote services. Alabama WIC does have extended waiver authority through 11/22. All staff have been shifted back to their base clinics. Participants can pick up special formulas and breast pumps as needed at their assigned clinics as well. So some information about trying to protect women, infants, children, and staff who need and get those WIC benefits. Let's see, here is something else. We're also, so the Mobile County Health Department and Family Health, our primary care division, are teaming with the National Association of Community Health Centers and the Voter Initiative to help residents register to vote for upcoming general election. So registering to vote is an obstacle course for too many Americans, and Voter, this new initiative, makes it easier to get registered. So if you are not registered to vote, or if you're not sure if you're registered, you can send a text message to text vote MCHD to 34444. So 34444, 5 digits, 34444. Text vote MCHD. And you'll probably see some flyers. This is just a black and white copy, but you'll probably see this posted on our Facebook site. All right. Also this weekend, the Mobile County Health Department, their rabies program, will be having a Saturday rabies clinic tomorrow, 1:30 to 3:30 at B&B Pet Supplies at 5035 Cottage Hill Road. Again, 1:30 to 3:30, B&B Pet Supplies on 5035 Cottage Hill Road. So it's drive-through clinics. Bring as many pets as you can safely fit in your car, but keep them in your car. And the cost of the rabies vaccine is $12 payable in cash. So again, it's really important to keep your cats, dogs, and ferrets current with their rabies vaccination. All right, and the last thing to mention is a Mobile County Health Department Family Health Division activity in Saraland. Yep, athletic, the 7th annual Pete Palmer Williams Group Athletic Youth Camp in Saraland at Skidmore Park on 624 Norton Avenue, Sunday, September 27th, 1 through 6 for boys and girls aged 4 through 13. Now, it's in a park, but that doesn't mean that you can gather without wearing your face covering. Make sure you keep your distance from 6 foot distance from people who are outside your household, and make sure you take a facial covering for yourself and your children that are older than 2, so that you can safely attend this event. There's going to be fun, games. The health department is offering, I believe they're offering COVID testing and maybe some STD testing. And again, Sunday the 27th, free event, 1 to 6 p.m., boys and girls aged 4 to 13. So with that, I will end our update today. I really hope that all of you that are still without power are managing and doing the best that you can. We think about you. If you lost damage to your home or to your yard or to your belongings, or some of my coworkers who have lost their appliances, you know, this is a time of community strengthening and coming together to help one another. So again, check on your neighbors, take care of yourself, hang in there. we will get through the Sally crisis together and then continue fighting COVID-19 and other things that face our community together. So thank you and have a good weekend.